Wonderful. There you are, present and accounted for. Okay, so here we go. So, Miles, I thought we could get started by having you introduce yourself. I will start with an introduction. That is, I grew up with two brothers, my dad who's a surgeon, and I feel like I learned pretty well at a young age how to talk to, or maybe be heard with men. I'm not sure if it was tactically the right way to go about it, but one of the things as a practitioner for 20 years, I've really been keenly aware of is that men just do not respond to the same recommendations, obviously from a physical standpoint with their body, but even more so, they don't respond with the same communication. And so for me, I came to you, the men's health expert, to help me not just get the right recommendations or better nutrition recommendations for men, but actually to help me talk as a practitioner, talk better to men. How can I engage them? So we're going to dive into all of that tonight. But to start it out, I would love to have you share your background with everyone, and we can get started there.
Sure, thank you. It's great to be with you in the Better Nutrition podcast or Facebook Live, and I'm glad we got the tech down. So I'm an integrative internist. So I'm a regular internal medicine doctor in Los Angeles, West Hollywood area, and really got frustrated by typical internal medicine, so did training in integrative medicine. I did a fellowship at University of Arizona with Dr. Weil, and I'm on faculty there. And here in LA, I'm on faculty at UCLA. So I've done a lot of work over the years in integrative medicine, which is basically looking at a much broader toolkit besides just prescription writing as a doctor, and looking at prevention as a big focus. So looking at lifestyle, what kind of things can people do in terms of exercise and nutrition and supplements and stress management, sleep to improve their health and prevent problems. But what I got really interested in is working with the underserved, people who weren't really getting access to integrative medicine. I started doing that in low-income populations, but then kind of found that actually in my non-low-income clinic, which is actually kind of a higher-income clinic, a lot of the men were similarly not accessing care in the same way low-income populations weren't, and they weren't really coming in, and when they did come in, they didn't feel like they were engaged by the broader community that was talking about these more preventive kind of messages and more lifestyle medicine messages. So I did a lot of work over the years, and I've written a book for practitioners. Now I'm coming out with a book this year for patients and regular lay people on what is unique to men about healthcare. So I'm excited to talk about that with you today, and how different the messaging needs to be to really get guys to engage. We know men aren't. They have half as much of a chance of seeing a doctor as women. They are dying younger than women. So it's an important issue to figure out how do we get men to make behavior changes they need to make.
Love it. If you guys see me looking down, it's not anything technology. I share this on a bunch of different pages, and I wanted to make sure I also was getting any questions or anybody telling us where they're joining from. So I will be, I'm doing dual duty here as the moderator and the tech person. Okay. So I thought we could start off because you actually, really sliced it open. And, one of the key things for me in this, in that whole space of understanding men was even before thinking about men's bodies, some of the earliest individuals that are talking to men about their nutrition are actually their moms. So I think that's really interesting. I've done a lot of work, looking at schooling and how we talk about health. And so when we put that context to it, and also knowing that you're a parent, you said something very interesting to me. You're like, Ashley, it's not about wellness, it's about winning. So I'd love for you to talk a little bit about winning and maybe how that could translate throughout life stage, whether you're a mom talking to a child or whether later on you're a healthcare practitioner talking to an adult, or even your partner who is male.
Yeah, it's great. Thank you for pitching that. It's a perfect pitch for me to say what I think is important. Because first of all, when I talk about men, let me just say that I'm actually talking about anybody who thinks like a stereotypical male. So it could be a female, and I don't mean to disparage men by assuming that they're more limited in their thinking. But when I say the word men, I mean most typical guys who actually don't hear messaging about abstract concepts as powerful as messaging around what do you need to do to achieve something, or in kind of male language, to win. So my big motto is when you're healthy, you can win. And I think it's exactly the same with kids. So I think it's great that you talk about how parents can talk to their children, because children also aren't going to respond to, well, you should eat vegetables so that 20 years from now you'll be healthier, or because this abstract concept of wellness is important. It's much more about, what do you care about, child? What matters to you? Okay, you're trying to do better in your softball team, or you're trying to win at games and sports with your friends, or even at doing better at hopscotch, or doing better on the tennis field, or doing better in school. Well, guess what? This is brain food. This is food that will help you think better. This is food that will help your muscles grow. This is food that will help you function better or be less tired. It's kind of the same with men. It's what matters to you, and then let's talk about what food or supplements or exercise are going to help you win at that thing that matters to you. So it's a very similar type messaging that I think is much more direct and outcomes oriented than the typical wellness messaging that just falls on deaf ears, both with kids and with a lot of men.
I love that. And so I feel like with practitioners that can direct you, into a different way of communication and even how you check in and that whole piece. So one of my absolute favorite things about you, I have many, but as we all know, those of you who know me, I'm a massive basketball fan. And Miles is the consultant doctor for the NBA, so I love that part. And one of the reasons I want to bring that up is I feel like earlier in my life, in my career, we didn't have athletes that were role models for better health. We definitely saw performance. I think a lot of the performance was really around, first of all, your natural gifts and then your training, if you train hard. So I'd love to understand, kind of what's happening at that pro level, even we're constantly, like I saw LeBron the other day was like, because he's not playing, he was like, oh, I'm not doing the carbs, I'm not doing the extra serving of carbs or whatever. So talk a little bit about on the athlete side when you're talking, because I think that's such a high level of performance that a lot of men have questions about.
Yeah, exactly. Well, a couple interesting things about that. It's, number one, really interesting to see how many athletes at high levels in the NBA, and I hear about it from other sports, are looking more at plant-based eating and not eating as much animal-based protein, that they can get their needs met and develop their muscles and stay on their game physically with plants as much as with animals. And I think that's really exciting because we know there are a lot of health benefits to eating more plants. It doesn't have to be 100%. I'm not saying everyone needs to be vegan, but we know it's really important to get as much plants as in terms of fruits and vegetables and whole grains in your diet. So the fact that we're hearing that from NBA players, at least one player in every team is pretty much 80-85% plant-based. So that's really exciting. And I think they're realizing that some of these trendy diets, and this is what's really important for your listeners to hear about, are not really good for you if you have a specific elite athlete type goal. If you're really working at a high level in sports, some of these trendy keto diets or some of these other diets are good for other things, but they're not going to be great for you if you're really trying to maximize your athletic performance. So that's a lot of what we talk about, especially the younger ones that get caught up in the hype of some of this, and their trainers and I are telling them, no, actually, that's not the way to go during the season especially. But a lot of it's about being individual and looking at what works for you as an individual. And so I think they're realizing that you can really tweak your performance based on dialing in for you what makes a difference.
I love that. And I started there because I think when we think about an athlete and a pro athlete, we're thinking their goal is very clear. Their body and everything has to be tuned in. It's a long season. It's that part. And yet when we think about men outside of that space, there are a lot of different goals. And so one of the things you told me about is like find out that goal. When we're not talking wellness and we're talking about winning, what is that goal? So do you kind of bucket goals, or where do you see men? What are goals that a practitioner can talk to a man about, and also what are some of the goals that you think men can be focusing in on?
Yeah, good question. I mean, obviously it falls into kind of some similar buckets, and I'd say those are being really, these days we're seeing number one goal is being more on. We're seeing a lot of guys complaining about being tired, being stressed, having sleep issues, just not being able to focus and really excel at whatever matters to them, and that could be at sports or at work or whatever. So that's number one. Number two is sexual function. My blog actually coming out tomorrow on my site is about sperm counts dropping in men dramatically over the past several years, and there have been write-ups in almost every journal that talks about men's health about that. And why is that? So sexual health and impact on fertility or another big kind of goal that men have. And then the other is sports and athletics. So I think mental focus, sexual function, sports and athletics, or physique I would put in with that. Fitness are the three big ones. And really just, honing in on trying to figure out, well, what's the one thing that you would count as a win if it got better over the next 3 months? And that's how I really start working with men. Which one thing that if something could change in your life, you would feel like, my life has dramatically improved. And then let's dial in on what's impacting that in a negative way.
Love that. So let's talk about maybe the man in your life who is not, maybe they have a win or a goal, and they're not able to either express it, or other things are kind of humbling them or keeping them from actually talking about that part. Or in the case of caregivers, we have an elderly parent, on that part. Are there techniques for having a conversation with a patient? And I think also I'm going to add in something. You always give me these pearls. Like, you have men who come in to see you, and they're pretty doubtful. Like, they're like, I come to this annual every year, like it does nothing for me, right? So how do you actually inspire hope or start the conversation with a man if it's something that you're aware of, whether you're a woman or another man, but you're aware of in their life and you'd like to get them help with?
Yeah. I think it's really finding the one thing. I think, again, to generalize, you can't talk about broad things with guys. Oftentimes it's one thing to hone in on. And so you can usually find one thing that you can ask somebody, is there anything that you're concerned about health-wise? Is there any way your health is bugging you? Which one thing that could be better? And not to ask kind of more broadly. And then just really ask them, would they be willing to make one change that you think would impact that one thing? So it's all one step at a time. I think that's really the key. And it doesn't have to be something deep, and doesn't have to be something that's, airy-fairy. It can just be, very practically speaking, okay, what are you concerned about that could affect you over the next several months or years, and help you figure out, is it something that is measurable? And that's another big key, is finding some way to measure the thing that matters to them, and then give them something to track along those lines. Because if you find something that you can track, so if it's about being mentally sharp, then find some cognitive tests they can do. If it's about risk for heart disease, look at some lab measures. If it's about sexual function, find some way that they can just measure on their own scale of 1 to 10 how their libido is. But something that then you can follow up and ask them about and record is a big key. Nowadays, with a lot of things that matter to men, they can use wearables to track. I mean, there's so many devices that can track elements of fitness, elements of rest and relaxation and sleep, and that's really gaining some of that and making it more fun to kind of track some of the outcomes that matter to guys.
I love it. What a layup. So I wanted to direct the conversation to our men's, Better Nutrition men's evaluation that we collaborated on. That certainly is a tool for men and also for practitioners working with men, where they can go through and, like the other evaluations, really look at total nutrition and then also lifestyle factors. So we looked at foods, beverages, supplements, lifestyle, all the things you were talking about, to help them figure out their win, and also then see how nutrient intake could be impacting that. So if we think about that part, some of the pieces that have come up as questions, somebody did ask about plants versus animal, because they said that they're a vegetarian, the woman is a vegetarian, and she was asking about her, sounds like I didn't catch if it was a boyfriend or husband, but she was saying that they're really struggling because he says that he needs meat. And so he's doing more of a paleo / keto, like he's hitting the meat hard on that part. So when we did the assessment, what are some of the things that if somebody, so there's no question for anyone watching, every human body needs plants, and there are nutrients that all animals rely on getting from plants. So that is part of the assessment. But from the meat standpoint, when we're talking about that, are there people that should be, are there men that we should be, let's say that a man does want to be keto or paleo and get the meat in. Do you complement that with then supplements that maybe they might be missing, or like kind of what's your protocol once you have that information?
Well, a couple things. I mean, I think, I get that a lot. People respond to my posts and things when I talk about eating more plants. And again, I'm not a big diehard, you have to be vegan, but just eating more plants. I get these guys who write, no, you have to eat meat. You have to have some kind of meat every day. I mean, and so there are two issues there. Number one is no, you don't actually need to eat meat. But some people do feel better eating some animal protein. That's totally legitimate, and we don't know. Is it a blood type thing? I don't think so. There's some, questionable quality data about that. But some people just feel better on eating some animal protein. Great. You've got to listen to your body. But it isn't true that everybody needs to have animal protein. You can get everything you need from plant-based sources of protein, fat, and carbs. But for somebody who feels better on animal protein or who's for fitness reasons or neurologic reasons or trying to do keto or paleo, I say number one, I don't know anyone that's really had issues from adding fruits and vegetables to their diet in terms of carb intolerance, hyperglycemia, diabetes, obesity. Juicing, yes, because then you're getting tons of carbs all mushed together. But having the whole fruit, fiber and all, is never going to make anyone fat or diabetic. So I always argue with those people, really, can't you do your paleo keto and have some vegetables at least? But if they're diehard and they feel like, no, I got to check my urine, check my keto stick, and I got to be in ketosis, then absolutely they need supplements because there's certainly lots of nutrients they're not going to get in their diet. And so I have, on my website, there are links to the top 10 supplements I recommend for men. At a minimum, if they're not eating enough fruits and vegetables, there's a really good multivitamin pack. I love one from Metagenics. There's one that Innate Naturals makes that's food-based. So I have a couple different recommendations on there. But certainly a good multivitamin would keep them covered at a minimum. And then depending on other issues they have, I'd add on some other things.
And I love that you're mentioning that. I also trust your recommendations. But one of the things in that whole notion of like setting a goal and figuring out what the win is, I just want to throw back and actually talk a little bit about the assessment piece because, doing the men's evaluation, we were both agreeing, gosh, when you talk about just a man, it's not okay to assume like that any two men are at the same life stage or the same. So the goal of the Better Men's Nutrition Evaluation is to have that data to understand the total nutrition, what's going in and on their body most often. But you actually have tools that are really unique, and why my patients have done well on that part working with you, and you've talked to me about some of the experiences of your patients, is that you use different diagnostic testing, and you also have the TAC 180 program. So talk a little bit about how diagnostic testing can actually be a tool that I know, like, my dad just loves it. Like, he loves to go back and get lab work, like, because he can see what's changed and what happened. Maybe that's the medical in him. But talk a little bit about how you use, whether it's micronutrient testing or genetic testing, to help you give a man, that goal and then the time frame.
Yeah, and by the way, I love the Better Nutrition Evaluation that we did together because I've had probably 30 guys do it just in the last month, and everybody finds something that they didn't realize that they need to tweak. So it really does go into the right level of detail of helping people just stop and think, okay, am I getting enough of this? Am I getting too much of that? So I think that, I really love the collaboration we did on that, and it's really
I'm laughing because, of course, I wanted it to be 12 pages longer, and he's like, it's for men, and I'm like, all right, right. So that's the laughter.
It can't be any longer. Yeah, it's right. The perfect balance. I think we got the sweet spot of getting good information, but not too much. But yeah, so for me, I got really frustrated with the annual physical and the limitation and the labs we get from that, which really don't tell us much in terms of prevention, in terms of what could be around the corner. It just tells us what is broken. And if we're trying to get guys to make behavior change, we need to know what are they at risk for that could go wrong, that could interfere with these goals that they want to achieve. So to me, you need the goals to help pull someone to make some changes, but you need to know what risks they have that could interfere with that goal. And that's what the testing as part of my TAC 180 program looks at. It's what could get in your way. So the number one thing is heart disease. So we do a deep dive into cardiovascular and, in fact, metabolic, which is related to blood sugar issues that could cause problems that could interfere with a lot of different goals, much deeper than your annual physical. And these are measures that are proven, that are very key to find out if you're at risk of heart disease or diabetes or stroke. And then we also look at imaging to look at things like plaque around the arteries. Is there already plaque there? No matter what your cholesterol is, some people with high cholesterol, don't have much plaque, and then you don't need to be on the statin or worry as much. Some people with not such high cholesterol, but other markers might have a lot of plaque. Bob Harper was the famous trainer on Biggest Loser, really fit guy. He had a heart attack at the end of 2017. We talked about that on a Facebook Live we did once before, because he had these other markers that were off, not cholesterol, that are included in the testing I do. And then genetic testing is really exciting. There's so much testing we can do now to figure out what's your individual risk, and then what individually do you need to do different from someone else in terms of diet or supplements or exercise to prevent problems. Knowledge is power, and if you know that you have these certain genes, it's not a fixed thing that you're going to absolutely get a problem based on those genes, but it means that you need to tweak some things you're doing so those genes don't impact your life as much as they could. And then something pertinent to what you do is looking at vitamin levels. We look at all your micronutrients. So, vitamin D is just the tip of the iceberg, and that's what everyone checks, but there are a lot of other vitamins that are important in your overall health and your immune system and in fighting off colds and your ability to build muscle, your ability to have energy and not feel fatigued, your ability to keep your brain functioning. And so testing all those to see maybe you don't need some of the supplements you're taking, maybe you need other ones, and maybe your diet needs to be tweaked. Looking at hormones. So there are lots of different tests. People can check out my website, tac180.com, to check it out. But I think it's such an exciting time to be practicing medicine, because there's so much information that we can get for every patient to really give them a personalized strategy for achieving those goals.
I love it. And I had somebody react recently who said, with all these tests that I can do at home, it's like we don't even need the doctor. And I'm like, hold on, now you're wrong. Like, there are a lot of tests online and places that you can take, but a lot of them actually have like fairly mass recommendations that they're then prescribing. And so one of the things that I really love about your program is the test, but what we're paying for and what we get is the ability to work with you on then developing the plan and retesting. I think as practitioners, that's one of the things, especially with men, that I learned from you is so critical, is to give them a time frame and say, hey, this is what we should expect, and let's see your results within that time period. I'm going to move us over to questions. We've got about 5 minutes, and anyone who's watching from a number of different places, again, I'm not intending to be rude, I'm looking down. And then I got the sweetest thank you. Somebody privately wanted me to ask this question. They sent it in a messenger instead of posting it here. And I'm going to hold back the tears. She put in there the face of like where she has tears. And she said she's been married for 30 years. Her husband is morbidly obese, and they have not had sex for quite a amount of time. And she said she's just she's like, it's the trifecta. He's depressed. He's this. She's like, is there anything that is just that first step forward? She's like, I can't even come up. So in that space, without getting into any more of you gave me a whole slew of personal things. So I said, smart to connect with you. But here, I think this is something that can feel common, where it feels like there's so many different pieces going on: diabetes, heart disease, et cetera. Where do we start?
Right.
So any recommendation for her there in terms of communication with her husband on that part, or what he might do moving forward?
Yeah, I know this is the Better Nutrition, department, but really it's about moving. I don't know how, if he's exercising. To me, that would be number one, because that reinforces so much. Mm-hmm. Maybe they can do something together, going for walks or going for a short hike and just starting slowly, but moving helps mood. It helps boost some of those. It helps you feel like you want to eat healthier, because you want to be able to move better if you feel you're limited in how active you can be. So that can be very motivating. So I think that's the first step, is don't even talk about diet or supplements or anything else, but just to start getting him moving more. And again, that can be walking around the block or setting a goal. The other, that's the second big thing, is if you're talking about starting any kind of program, and like with him, whatever he can do now, add a little bit to it and set that as the goal and say, we're going to check back in on this date to see how you're doing, and then we'll build up from there.
Thank you, and I could not agree more. Shifting gears very specifically, I got a question about creatine. And so creatine, we asked some questions in the Better Nutrition men's evaluation about your supplements and what supplements you might be taking for performance and body composition. But just straight out question, is creatine okay/good?
Great question. It is. That's probably one of the most studied supplements, because so many guys take it, and It actually works, and it's not unsafe. We worry because we feel like it has to be filtered through the kidney, and that's one of the things we monitor in checking kidney function is creatinine. But actually, it has been shown to be really safe. It does work. It does help to basically boost a little bit of strength so that then you can work out. It's not magic. You still need to work out harder and lift more weights, but it does enable most guys or girls, whoever's using it, to feel a little stronger, their muscle cells get a little bigger, and they then can lift more weight and then actually get real muscle growth. Right. The key thing with creatine, I will just say real quickly, is you have to do a loading dose. It's one of those things, if you just take a regular dose of about 5 grams every day, it'll take forever to get to a real level that it helps. So you really load it up like 3 to 5 times a day the first few days, and then take your once-a-day dose.
Awesome. And someone here said they started taking CoQ10 after I did a Facebook Live on CoQ10, but he is wondering about cognitive function. What can he do for he's aging, and what can he do to help his brain? I'm assuming at this point, if you're welcome to weigh in, but if you're saying to keep your brain function, not regain. But anyway, yes, cognitive function. Right. Yeah.
Well, I've done some blog posts on it, so check out my site, because there are a lot. It's an exciting time. They're called nootropics, is kind of the broad term for all of these different type of supplements that can help brain function. And with what you do, it starts with eating. So you got to be, eating your fruits and vegetables. So supplements aren't going to make up for eating poorly, right? And obviously fruits and vegetables are the main thing. But in terms of supplements, I would say it starts with something like acetyl L-carnitine, which helps build ATP or energy in the brain. And then there's some newer things like NAD has a lot of good science that it helps brain function really well. There are some other combinations of these nootropics, something called Bacopa, B-A-C-O-P-A, can really help neurologic function. Even ginseng that we've heard about for years can help. So there are a bunch of them, but I would say starting with acetyl L-carnitine and NAD, those are two of the good ones to think about.
I love that. From a dietary standpoint, Miles mentioned your diet. I have to just put a stake in the ground. You really have to look at your added sugar intake. I think that is something that we, and we do have the added sugar evaluation. To me, that's really key to make sure that you're setting a budget and you're sticking with it. I want nutrition to be delicious, and I want you to have a range of choices. But I think from a cognitive standpoint, and for many other reasons, that's very important. So I thought we would conclude, and we do have other questions. We will, one I put up here in the intro. There, you can sign up for Miles' newsletter. You guys, I have to tell you, it's one of my favorite newsletters to get because it is so efficient. So I'm learning so much about the communication. I feel like I win just reading it. And you're linking to some great articles, like the recent one on CBD dosage, and some really relevant stuff. So thank you on that part. So everyone can sign up there, and also, of course, his blog, and TAC 180 is where there's information about that program and a lot of the different services. So I want to conclude with a topic that we both love, and just your thoughts on the role of adaptogens for men, sort of what you're seeing them as helpful, maybe as a first line in place of medications, or kind of how as a practitioner you're using adaptogen herbs.
Yeah, I mean, everybody's stressed out. Their stress is inevitable, but there's a lot you can do to decrease how much stress impacts you physically. And that's a lot of what we're seeing in guys is physical manifestations of stress. So obviously, just like I was saying, start with diet before you add on supplements. Start with some kind of daily practice that helps manage stress, like meditation or prayer or journaling or some kind of connecting with others. Added onto that, though, there's a real role for supplements. There are things like ashwagandha, which I love, maca, holy basil. My favorite's probably holy basil, because that does a lot of things. And these are all really great supplements because they don't make you tired, but they just help your body deal with that inevitable stress. So there are some combinations that have all those in there, but I would say those are probably my top 3, especially like I was saying, holy basil. It does a lot of good things. But ashwagandha, I wrote about it in my blog post this week in terms of even helping with, like I was saying, sperm production and fertility issues, probably because stress lowers fertility, it lowers testosterone. And so if you take something like ashwagandha, that can attenuate that impact of the stress on it. So there's a real role for that on top of some kind of basic daily practice that helps you just deal with life.
I love it. And so we do also have more information on adaptogens over at the Better Nutrition Program. And also, and it's a great layup to conversation for joining us next week for our expert interview, I will be talking to Dr. Sandra Carter about medicinal mushrooms. And so many adaptogens are medicinal mushrooms. And I think it's really important for us to know because just like you're talking about ashwagandha or holy basil, which also goes by tulsi, you might grab this in a tea, but these days you might even find it in a smoothie. You know, we're seeing it. I remember when ginseng hit the popcorn aisle, you know, and that kind of a thing. And so I think it's really important to know how to review the quality of something and whether you're getting something at a therapeutic dose or, you know, maybe how you can look at and especially work with your practitioner to make sure you are aware of what interaction something could have with your medication. You know, things like reishi and cordyceps can help with, as you were talking about, help with stress, but they can also lower your blood pressure. So if you're on a blood pressure lowering medication or following nutrition recommendations, we don't want that blood pressure to go too low all at once. So I think some helpful information. Amazing, Miles. So grateful. Glad we worked out our technology. Everyone, please share this with your female friends, your male friends, and please head over to Dr. Miles Spar. You can find him on Facebook. You can find him on Instagram. My favorite way to find him is at his newsletter. So here it is. I don't expect anyone to read what I actually put on the screen, but I put it in the blurb associated with the Facebook Live tonight. And if you have any more private questions, feel free to send them to me in Messenger, and I'll get them over to Miles. Or you can, of course, head over to his website and send him a question there. So thank you.
Thank you, Ashley.
Absolutely.
Great to talk to you.
Bye. Okay.
Bye.